Well, hello, hi. I'm Dr. John McAllister, and I'm a dentist in Downey, California. And I'm going to be going through the before and after of one case that's on our website. This is our website right here. It's Laser Gum Dentist, and this is the home page. But where this case is at is right here on reviews, and it's on the before and after page. I'm doing this video because Picasso used to have a ability to show the case, but now it's all it shows. If you look down here, is this little link, and it no longer shows the actual photography of the case. So if you click on this link, you'll go to the Google Plus now page, and it'll start with the photography of this case. And this case is a case of periodontally worthless teeth that get Invisalign and Veneers. And what does that mean? Well, basically this patient came in and she had advanced gum disease. And in a moment I'll show you what that means. And the problem I had was, yes, I could get rid of the gum disease, but what about the cosmetic end result? This was her smile starting out, and we ended up with a smile that looked like, then we ended up with something like this. So this is her after smile. But when I first saw the case, I was concerned because she had advanced gum disease. If you notice here, this is a periodontal probe that's inside the periodontal pocket at almost, this would be a 12 millimeter pocket. Traditionally, most dentists would consider removing these teeth. And I actually had that moment. I was concerned because I could get rid of the gum disease with LANAP, but then we would end up with a cosmetic concern where you'd see how small this lateral is, and then this tooth was rotated, and there was gaps in the front here. But the patient fortunately decided that she wanted to keep her teeth no matter what. And so let's take a look. This is the after. This is immediately after placing the veneers. So the initial probing depth, if you remember, it was down about right there. Now we have a depth of about 2 millimeters. This was right after these veneers were seated, and you can see the gum is a little irritated. That's because I was polishing around the margins of these veneers. So as you can see, we got rid of the gum disease issue. She's had these. In other words, the initial treatment was 5 years ago, and she has not lost a tooth. We did move her teeth with Invisalign, and we did place veneers on. She does write on my Facebook page how appreciative she is with what we did for her. She says that her daughter wishes that she had her teeth. But again, initially, cosmetically, it was a challenge, not just periodontally. Periodontally, any dentist would have considered removing these teeth. What I'm trying to show here is how advanced a case we could take with gum disease, and we can get rid of it. We could reverse the condition. But not only that, but now we didn't place anything like implants here. Any dentist would have easily removed all her teeth and would have placed implants. The cost difference is enormous. A case like this, anywhere from $50,000 to $100,000 to put in implants. With LANAP, Invisalign, and Veneers, about $15,000. So a significant savings to the patient, but it's not just the savings to the patient. It's keeping their own teeth. The literature shows very clearly that teeth cost the patient 5 times less than maintaining an implant. So the cost savings over her lifetime are going to be quite a bit by just saving her teeth. Again, she started out with some cosmetic concerns, large gaps, micro teeth that were in poor position. Again, 12 plus millimeter pockets around the teeth. The idea of this case is also to show how extreme how extreme a case that we can now reverse with people who have gum disease. We can now reverse their condition, and this was an actual extreme case. So we were able to get her to here with Invisalign, but again, the cosmetics of having a small tooth here, the gaps between the teeth, the rotations, so you could see the attachments for the Invisalign there, and that was right after when we finished the Invisalign. She wasn't happy with that result. So, and again, this is the before, 9+ millimeter pockets around these teeth. The after being at 2+. These are the preparations for the veneers. This is the before of this same case when she first got to the office. A lot of very advanced gum disease situation. But then I've been doing this 10 years now, but this would have been about at my 5-year mark. And I knew what we were able to accomplish periodontally. Cosmetically, I was concerned with this situation. But she wanted a beautiful smile, and we were fortunate enough to be able to give her that situation. This is the inside view of the case. This is the inside view before. So there's the before, and that's the after. Again, very appreciative patient. Saved her, again, a significant amount over the long term of her by saving her teeth. Again, 5 years, she hasn't lost a single one. These teeth were mobile. 12+ millimeter pockets. You could see how angry the tissue was. Very advanced periodontal condition. Getting new attachment. There's the before and the after. Again, the idea is to take the most extreme case and show that we could reverse gum disease with this. Now, if we could do it with a case that is this advanced, it's a lot easier to take an early or a moderate case and get rid of their gum disease. This is right after the Invisalign. Again, cosmetically just wasn't quite there, but these are the probing depths, so you could see that we had double digits around most of the teeth. Again, if you look at the literature, Mish has an article that he says that any tooth that has a 7 millimeter pocket or greater should be removed and an implant placed. I don't agree with him. Here we have double digits, 10s and 12s going down to 2s and 3s. Again, Mish sells implants. He sells courses on how to place implants. So he has an agenda. And I think dentistry needs to take a second look at all these implants we're placing. There's a lot of failures. Look in the website. Look up LAPIP, LAPIP, and you could see that implants have a lot of problems with them. So saving teeth is a lot better than taking them out. So this is just one case of many. I'm going to start doing these videos, posting them on YouTube, and then reposting them over onto the website. So take a look at these cases. Click on the red link in the website. It's right. Let me open that up again. It's right here. You just click on this, and you can go to where I was just at. And you could see the photography of this case. So I look forward to seeing you, and if you have any questions, come on over here, put in, that's another thing. If any of you are out there who are my students, and you'd be interested in knowing how I did put this little pop-up up, it's a nice little thing, and anybody who is interested, just go ahead and fill it out and send an email, or just give us a call. You can get $1,000 off LANAP. It's a really good offer. If the expiration code is not on here, just call us at 562-869-0928, and I'll extend it for 30 days. I look forward to seeing you online. Ask a question anytime right over here on this right side. And just, you don't necessarily have to give me an appointment date. Just a name, an email, and a comment, and we'll talk. Look forward to hearing from you. Thank you very much for taking the time to listen to this presentation. Thank you. And I'll see you in Downey, California.